This is part 2 of a webinar that Karin and I gave a couple weeks ago of how to basically cure allergies. And it's very timely, of course, because there's a lot of itchy dogs out there in these summer months. So in the last episode, we talked about how even though we have all these newfangled drugs like Cytopoint and Atopica and Apoquel to treat skin problems, they really are just a variation on the same theme of, if we don't like allergies, let's just suppress the immune system. And if we're lucky, we won't suppress it so much that we end up causing something nasty like sepsis, which does sometimes occur. So there's a lot of drugs that work like that, from chemotherapy to some drugs for Cushing's, where it's like, let's just see if we can take it right up to the edge of really doing some serious damage to our patient. But if we get right up to that edge, then we'll see some benefits. So that always struck me as not really a solution and always bothered me. And so chronic skin issues was a driving force behind me trying to, or just getting into holistic medicine and getting all those letters that you saw in the first slide. Now, I will say that holistic medicine is very gratifying in terms of treating skin disease. I will also say it took me decades, probably 20 years, to really figure out a relatively foolproof, meaning that probably 90% of animals get figured out expediently, system of approach. And before that, I found I was just trying everything on the shelf pretty much for some animals, and we probably still do that. But what we presented to you last time and what we're presenting to you this time is what I would consider a more sophisticated approach, something that pet owners can do for themselves, and that will yield results most of the time. And what are we defining as results? We're defining it as you essentially curing or substantially curing your dog's allergies without the need for drugs eventually, even though they may be on them to start with. Okay, so in that last presentation, we talked about how one of the reasons why we just don't have great drugs is because we just don't really understand the problem. And I framed the problem as there are actually two problems in the standard itchy dog population. There's about half of dogs that actually have a problem with their innate immune system. And the innate immune system, we talked about, something that's very impacted by what an animal eats. And that the more processed food the animal eats, the more it switches on the innate immune system and contributes to innate immune system excess. If you haven't seen the first webinar in this series, I encourage you to go and have a look at it, especially if your dog is still eating kibble. And then we left off that last time by saying, what about the rest of you? And I know there's a lot of you, probably most of you tuning in. You are the world's best pet owners, right? Like, you're feeding your dog expensive real food diets and probably giving a lot of supplements, and you still have a miserable itchy dog. That's who we're talking about tonight. Those animals that are on a real food diet already, they have an adaptive immune system issue. That's the immune system you're used to hearing about, the one that makes antibodies, B cells and T cells, and so-called cell-mediated immune system. All that's part of the adaptive immune system. And that, we're going to learn, is strongly influenced by diet, but only to the extent that the diet influences the microbiome. So let's get into that first. Just to recap, with the real food diets, or the first step you should do with an itchy dog is switch to a real food, because about half of you will experience an immediate improvement as that innate immune system promptly normalizes. And so by a real food diet, we mean it can be raw, it can be cooked or lightly cooked, it can be commercially cooked, can be something you make at home. The secret is it's not really made in a factory, it's not a kibble. It's not a baked diet. It's not a dried diet. It's not a kibble. Ideally, it's not even a freeze-dried diet. It's just some fresh food. And you must make that switch, because if you don't, you're going to end up maybe trying some of the things we talk about tonight and being dissatisfied. If at all possible, make the diet switch first. So for those of you who did change the diet and you're still having problems, what is this adaptive immune system exactly? So the adaptive immune system basically consists of kind of two arms. Okay, there's the immune system of the periphery of the body. There's accumulations of immune cells in your airways. There are accumulations of immune cells in your skin. There's accumulations of immune cells in your gut. Because this this is where the body gets attacked, right? This is where an invasion would come from. It's the skin or the airways or the intestinal tract. Now, by far and away, most of those outposts are located in the intestinal tract. We have fancy names for them. The cells in the intestinal tract are called Peyer's patches or GALT, gut-associated lymphoid tissue. And what those guys do is they sit there just on the other side of the wall, kind of like Game of Thrones, if you ever saw that series. There's the Night's Watch, and they're just waiting for the White Walkers to come across the wall. They're waiting for something to invade. And when they do see something invading, they sound the alarm. And they sound the alarm by sending out cells called regulatory cells or T helper cells, various types of chemicals called cytokines, and they circulate through the system like Paul Revere riding through Massachusetts. Paul Revere said, the British are coming, the British are coming. In this case, these circulating cells and chemicals are saying, the microbes are coming, the microbes are coming. And it puts the whole place on high alert so that your immune system is as primed as possible. Because let's face it, why would there be so many of these immune cells in the gut? Because there's so many bacteria in there. If there's going to be a breach in the gut, it would be catastrophic compared to a breach in your skin or a breach in your airway. And so we have a very reactive immune system in abundance in the intestinal tract, waiting just in case of a breach, which never happens, right? Except our doggies' immune systems are getting jazzed up anyway. Why is that? Because we're not necessarily dealing with wholesale breaches all the time, but if we have any weakening of the integrity of that intestinal wall, if instead of an impervious oaken door, it's becoming a screen door, then the immune system is getting way too uncomfortably good a look at who is on the other side of the wall. And if they're getting a really good look, they start to get agitated and they start to get excited and they start to send out signals to the far-flung regions of the empire saying to everybody, hey, up your game because somebody's coming and you need to take up arms. So let's say you have a skin problem and you have a leaky gut and you have the excited immune system in the intestinal tract saying, oh my God, the British are coming, the microbes are coming. And it sends out the alarm call and you have a mild skin problem for whatever reason, yeast, bacteria, a flea bite, whatever, and you're told to up your game, well, then that inflammatory response gets amplified. So this is what we call a cell-mediated immune response. And there's a really important implication here, which is that the food is impacting the gut. Your animal is not necessarily allergic to it, but maybe they are. It doesn't have to be allergic to it for this to be going on. And the inflammatory response in the skin can be due to anything. Can be due to scabies, can be due to fleas, can be due to ear mites, can be due to bacteria, fungal infections, etc. So that is the mechanism by which food sensitivities really aggravate skin inflammation when it involves the true immune system. And so the key to managing this situation is we gotta seal up the screen door. Gotta put the big oaken impervious door in the way again, so that the immune system is once again can't see what's going on the other side of the wall and has a chance to settle down. And it takes a while. It takes weeks, months even, for the immune system kind of like to settle down from the lack of stimulation. It's like a really misbehaving kid. It can sometimes take a real long time to settle down. So, but that's job one, is you got to heal up that leaky gut wall. Okay. What is causing it to leak in the first place? It turns out it's the microbiome that is the issue. And, or rather, we know through an abundance of research that the microbiome is what maintains the integrity of your wall. More on that in a second. But let's say we have a raw-fed dog and they have this problem going on. It makes sense that if we're trying to solve this problem, we're trying to understand what is going on, what we should do is look at the microbiome of a raw-fed dog and compare that to the microbiome of a kibble-fed dog and see what is the difference. And when we do, as we begin our quest to understand what the defect in the microbiome is, we find out there are no carbohydrate fermenters in raw-fed dogs. Those species of bacteria, like lactobacillus, they just don't exist. No big surprise, really, in hindsight. There's no carbs in the food. If it's all just meat and fat, there's very little in the way of carbs in the food, and so carbohydrate fermenters just vanish. They starve. And even if you give lactobacillus as a probiotic, if there's no carbs in the food, they will starve. They'll just pass right on through. Okay, so that's our first discovery. Okay, we're lacking carb fermenters. So the second question is, do carb fermenters play any role in somehow improving immune system function? And we find out they do. Carb fermenters, that niche in the microbiome, of which lactobacillus is an example, that niche manufactures something called propionate, which is a volatile fatty acid, very simple chemical. It ferments carbohydrates, manufactures propionate, which then gets absorbed into your body. Fair enough. What does propionate do? Propionate is a major immune system regulator. So what it appears to be happening in a raw-fed dog is that they are essentially suffering from a propionate deficiency, which means, in theory, somebody could invent a propionate drug, and we would have probably a great drug for the treatment of allergic dogs instead of using immune suppressants. And those kinds of explorations are beginning, at least in the human realm, but they're not really here yet. So in the meantime, if we want to make some propionate, A, we need the carb fermenters, and B, we need the carbs. We've got to add some of those back into the food. In other words, the animals might be suffering from a plant deficiency. Now, I was talking not too long ago to Ian Billinghurst, and I was explaining to him this theory because he's a big proponent of raw. He's the original proponent of raw meat dogs. And I was just spitballing about what I think it means, why I think a dog like this could evolve. If you think about way back when we're first domesticating dogs, right? There's going to be some that are very comfortable with us. They're going to come up close and they're going to be hanging out with us. And there's going to be some dogs that are very uncomfortable with us, but they recognize that humans are useful primarily because of the garbage they throw away, the rotting garbage in their little garbage dumps. And so I'm proposing that this actually makes sense, that we should have some dogs that are dependent on fermented foods for a proper function of their immune system, that they would have just become adapted to always having that in their diet, and their immune system functioning normally, as a result of eating that kind of diet. Because we have certainly examples of canines to this very day skulking around on our periphery, eating our rotting garbage, but very uncomfortable with being in close proximity with us. So I'm just throwing it out there that this kind of population of dogs that we're dealing with, that's might be where they came from, how they evolved. Okay, fair enough, you say. I'll start adding some carbs. Is there anything else I should add, or is just carbs enough, or carb fermenters enough, or should I, just throw the lactobacillus in there, or Bacteroides? That's another carb fermenter. Is that sufficient? No, because as I said, you need a food source. You can give probiotics until you're blue in the face, brown in the face. I don't know what the color is, but you can give those, just on and on and on, and they won't work if they aren't fed. You can give prebiotics, you can give this supplement, you can give that supplement, but if they just don't have a food source in the intestinal tract, then they are not going to survive. They're not going to colonize at all. So I'm proposing, and I know there are as many different ideas about how to treat allergic dogs almost as there are holistic veterinarians, but my particular slant, which does seem to work most of the time, is that these dogs do need a carb source. Not a lot, not like rice or potatoes or bread, but something that's kind of a dilute carb source, maybe with a lot of fiber in it. I'm going to get to that in a second. Maybe with a lot of protein in it. So sweet potatoes are a great example. Most dogs love sweet potatoes. You can just mash them right into the food, and they'll scarf them down. But really, any vegetables or berries, you got to be careful with onions, right? And really be minimalist with the garlic, no onions at all. But otherwise, there's a lot of fruits and vegetables that you can get away with giving. So just take a look and see what needs using up in your crisper, and start to put that in the food. Now, don't make it most of the food. Make it no more than a sixth to a third of what's in a dish. If your food already has a lot of plant material in it, you don't need to do this, right? But if you're on a pretty raw diet, or where it's just 10% plant material, yes, you're going to have to, I think, add some plant material along with your probiotics in order to get those good results, to lay the dietary foundation for success. There's another reason why plants are helpful in these cases, and that is their fiber content. So the fiber content is used by other types of bacteria. An example is bifidobacterium, to make butyrate. So we have propionate that is used to regulate the immune system, and we have butyrate that is used to seal up the gut wall. If you look at that picture, you have a leaky gut and you have a normal gut, and you can see there are spaces between the cells on the right-hand side of the diagram, and those are sealed up by normal tight junctions on the left-hand side of the diagram. Those tight junctions are created by butyrate, thus by bifidobacterium, among other species. So one more reason to include plant material in there. You don't have to get too meticulous. You might say, what plants? There's a lot, just get them in there. Okay, so who's going to benefit from that? What's the typical looking dog that is going to benefit from this sort of dietary foundation that I'm describing to you? Just to recap, you're doing a great job with the food. They're on the highest quality raw meat diet or cooked meat diet. But particularly if it's low in plant material, the skin issues either don't resolve or they were never even benefited by having that diet in place. Interestingly, a lot of these diets or a lot of these dogs are also anxious and aggressive, and that actually aggravates their skin issues. And I'm going to come back to that in just a second. They oftentimes have a history of inflammation elsewhere, particularly cruciate tears, hip dysplasia. Another feature is that these dogs tend to have problems about every 6 months, with one of the bad times a year being now. Basically, if you're in the northern hemisphere, from July through to July, August for sure, somewhere in there, and then really kind of for some dogs extending all the way into November or early December, and then we picking back up again 6 months later. So January, February, and then now your dog might used to have been irritated every 6 months, and now it's 12 months a year. Okay, then your dog still fits that scenario. You may have, and I realize not everyone in this audience will have, but you may have used immune suppressants, and you may have found they actually worked pretty well for a while. But when you either try to cut back on the dose or you just continue using it, it eventually stops working. The problems start to come back. You may also have actually gone ahead and done immune testing and identified some allergies. But notice, both of these talks, I am not emphasizing any importance of allergy testing and desensitization, because I don't find it's particularly useful or needed to manage most cases. If you have animals that are obstinately unimpacted by the kinds of strategies we talked about tonight and last time, and you've applied those methods diligently and you're not getting anywhere, then you may be part of the minority that needs that kind of analysis and intervention. But I'm going to say that most dogs don't need allergy testings. Most dogs don't even need microbiome testing. I don't have a problem with it. It's just that we know that there's going to be this niche that is not filled in raw-fed dogs of there's no fiber fermenters, there's no carb fermenters, and that's going to have an impact, a big impact on the immune system. Okay, so if that sounds like your dog, then listen on. What probiotics are we going to use? We mentioned Lactobacillus bacteroides as our carb fermenters and Bifidobacterium as a soluble fiber fermenter. I'm not going to recommend brands to you because there's a zillion brands. I'll leave it to those other companies to kind of promote their products. I do oftentimes use Gussie's Gut, which is a kind of, it's a probiotic made on fermented plant material. You can search them up online. It has these species in it. Not in any tightly controlled sort of way, but it seems to work well. But you also may be a fan of other lines of products like Adored Beast or Four Leaf Rover. And if you don't ask us, is this good? Is this good? Just look at the label. And if it has those species in it and you're satisfied with the quality of production, Maybe you've even asked the company, how do they know this product is viable? And they've got a good answer for you. It's probably going to be fine. So just use whatever you're drawn to. Okay, so we talked about this cell-mediated immune response that starts with leaky gut, propagates the entire system, gets everyone excited, and makes a mess. There is one more component to the pathology of these dogs, not cats particularly, but dogs. And that is something called endothelial dysfunction. Now, if you're an Ask Dr. Steve participant, you have probably heard those words before. You've probably heard them way more times than your veterinarian ever has, because we're not taught this stuff in vet school, even though, I kid you not, endothelial dysfunction is considered one of the leading causes of pathology and death in humans. Most of the time, we worry about it in the context. You might think, really? That just sounds like hyperbole. Okay. Did you know that 3/4 of the adults in North America are taking blood pressure medication? Blood pressure medication is used to treat endothelial dysfunction. So if people are on blood pressure meds, they have this. They just have never been told that that's what this problem is. In endothelial dysfunction, so a few things happen. The lowly blood vessels going through the tissues, they start to shrivel up. They start to attenuate. They get narrow, number one. So you might imagine it cuts off the blood supply a little bit, and it raises blood pressure. Number two, though, if you just imagine my fist is a narrowing blood vessel, then number two, the blood vessel starts to leak. So cells that were kind of coursing through the tube start to come out through the gaps between the endothelial cells. You can see that depicted in the diagram there. And these white blood cells, the ones with the blue nuclei there in that picture, are neutrophils. They go into the tissue, and neutrophils are just, there's nothing reserved about them. They go in there and they degranulate, and they just start to trash the place. They release free radicals. Those free radicals from their lysozymes damage the tissues and create inflammation for no good reason, just because the vessel is leaking and also becoming sticky. So that's the cell population you end up with in a chronically inflamed tissue due to endothelial dysfunction. As well, you start to get a problem with poor blood flow, just cells not flowing readily, red blood cells not flowing readily, platelets starting to stick, lots of other issues, clogging up the blood supply of that tissue. What it means is that that tissue stays permanently inflamed. It stays permanently inflamed. You know, if you had asked a practitioner or medical researcher from 30 years ago, you'd say, hey, doc, what stops inflammation? How does it go away? They would have assumed that it just fizzles, that whatever caused the inflammation is destroyed. And then once that destruction is complete, then there's no more chemical attractants to draw in more cells. And it all just fizzles and dies down like embers of a campfire. It's wrong. That's not what happens. The inflammation just is like the Terminator. It just won't stop. It has to be actively resolved. That's actually a genuine medical term. You can Google it. You'll find it as the antidote to endothelial dysfunction. In this active resolution, we have to dilate our blood vessels, increase the blood flow to the inflamed place, kind of beginning to get an idea of where I'm going with this. And our leaky cells, we have to seal them back up so that our white blood cells don't escape into the tissue anymore. When we seal everything up, the edema that's in the swelling of the tissue, the edema, the free radicals, they get sucked away into the lymphatic system, and the cell population changes. It changes slowly from one where there's all those blue nuclei cells to one where there's just a couple of quietly observant cops just standing there looking. So but that's how the war zone ends, is just a quiet, minimalist police force that is nonetheless very vigilant. That's on the right-hand side of the diagram there. I say there's an ice pack phase and a hot tub phase. An ice pack phase is where you got too much, everything's hot and inflamed, and you need to, even though you have these leaky vessels, there's just the tissues engorged with blood and swelling and edema, and you just got to just suck those cells down as quickly as possible. And then for the active resolution, you have to let the blood supply come back. You have to dilate the blood vessels again. That's why I call it the hot tub phase. You have to bring the circulation back. Now, I want you to just notice one more thing, because I know you guys are great pet owners, and I know that you have worked many of your dogs up to the nines trying to figure out their problems. You may have heard of a phrase called lymphocytic plasmacytic, fill in the blank itis. That word, lymphocytic plasmacytic, in a biopsy report. And your veterinarian will have assumed, because those are immune cells, that this is an immune-mediated disease, and therefore we need to suppress the immune system. Very logical. Except that if you take a look at between that acute inflammation and the first resolution phase, that dotted line right there, you see these cells. I hope you can see my arrow. We have B cells and we have T cells just sitting there. Those are, B cells are lymphocytic, are plasmacytic, and T cells are lymphocytic. Lymphocytic plasmacytic inflammation also just means inflammation that has not resolved of any cause, not just the immune system. So that means if we can just fix the blood supply, we could actually get rid of these lymphocytes and plasmacytes and end up with our quiet little police force, just like vigilantly watching for any other future damage. Okay, so how do you know that this is going on in your dog, that they have the so-called endothelial dysfunction? Well, Chinese medicine called this blood deficiency. They felt, rightly, that there was a condition in which you'd have a crappy blood supply to your skin that would be marked by chronic inflammation. If you had dogs with ear margin dermatosis, like in the picture there, and their ears are often cool, and their paws are often cool, and their tongue is kind of a lavenderish color, the coat might be feeling a little coarse or dandruffy, a little thin, maybe not much of an undercoat. There might be scurf on the top of, especially on the dorsum, on the back. And when you take a close look at the dander, it's kind of like white flakes or even translucent flakes. Those are all cardinal signs that your dog just has this endothelial dysfunction. It may not even have the leaky gut, just the endothelial dysfunction. You might assume that this is somehow repaired by diet, and it often is, but it frequently is not, or at least takes a long time to be fixed with diet. Actually, Lena's dog, Bismarck, had this going on when we were treating him for his disc issues. And she noticed the diet had a pretty prompt impact. But you may find that you need to help things along. And so if you do, there's a famous formula called 4 materials combination that basically counters this endothelial dysfunction, that dilates the blood vessels, seals up the blood vessels, and basically converts the hotly inflamed tissue, followed by the dry scurfy tissue, into just a normal hair coat and normal skin. Now, most people don't use that by itself. They usually use it in a context of other herbs. Let me just show you a simple blood deficiency case, and then we will move on, and I'll show you the formula that we usually use this 4 materials combination in. So here's the first case, Bow Bow, a Cocker Spaniel, 2 years old. And one hint that you might be dealing with just a deficiency is that the dog is young. So younger dogs tend to have more problems with deficiency, especially if your dog is under a year of age. They're either immune deficient, which we'll get to, or they're blood deficient. And so Bow Bow is still a young dog, and he has skin problems already in his young life in the form of what we call superficial pyoderma. We don't know what month this is, but previously he would have these little lesions and they would kind of flare up and go away, flare up and go away. That's because staph infections would kind of attack the skin because there isn't a good enough blood supply. So then there's this rush of blood to the area and it kills off the bacteria, and there's enough blood vessel function for that inflammation to get actively resolved. But meanwhile, the entire system is still compromised, and so some other place erupts with an infection, and then there's an infection over here. It's like playing whack-a-mole. It's not a good enough blood supply to the body periphery to whack all the moles simultaneously. So if you have a whack-a-mole dog, that's what's going on. Okay, so his whack-a-mole's gotten out of hand, and now his problems are generalized and persistent. He has, for those veterinarians that are listening, typical weak pulses, which you would naturally would assume means you have sucky peripheral circulation, right? If your pulse is weak, then of course you're not going to have a great peripheral blood supply. The coat's dry. He has scaly lesions all over his dorsolateral surfaces. From a Chinese point of view, it's harder to get good circulation to your back than it is to your belly. And so a lot of dogs that have just dorsal dryness, we know that they're having a trouble getting good enough circulation to their body periphery. His hair kind of came out easily, and it worried me a little bit that he might have a fungal infection. He's also a little gassy. Sometimes gassy dogs don't do as well on blood tonics because it can suggest that their intestinal tracts are a little bit inflamed. And if you use the 4 material stuff in a dog with an inflamed GI tract that nobody knows about, then you can see some loose stools. Nevertheless, decided to go ahead and treat this dog from a blood deficiency perspective. We gave him the equivalent of dry derma relief. It's a 4 materials combination. Here's another tip off that your dog has blood deficiency, is they respond to omega-3s. Like you put them in the food and you notice within a couple of weeks, oh yeah, their coat looks a lot better. If that's you, if you've noticed that, then it's one more reason to suspect so-called blood deficiency. I was going to do a fungal culture if he didn't improve, but he did improve. His hair completely regrew. The scale quickly retreated just to the rump over the next few weeks and then resolved entirely. Okay, so that's just one example of a blood deficiency situation. So it's always gratifying as a practitioner if you get those cases. And I got those cases when I first started treating skin problems in dogs. I joke with veterinarians when I'm teaching them, I'm saying that there's a case dispenser in the sky that sends you cases to kind of build your confidence on. And then, when you start getting cocky and you lack humility, well, don't worry about it because the case dispenser in the sky will give you humility. And humility usually comes with full-on adaptive immune system disorders. So our goal in those dogs, okay, now we're harkening back to that dietary foundation we laid. We got the real food diet. It's like a third to 1/6 of what's in the dish is plant material. We got a lactobacillus bifidobacterium or Bacteroides probiotic in place. Some of you might have things like Enterococcus or Fortiflora, or veterinarians are fond of probiotics that unfortunately are not species that do any of what we need for skin stuff. So if you're using those products, they're not going to work for you because those bacteria don't occupy the niche that you're looking for. Okay, so our goals for those other harder dogs, not the simple blood deficiency dogs, our goals are to heal that leaky gut, right? Seal the leaky gut. Let the immune system settle down because it can't see the bacteria anymore. And when they settle down, the whole system settles down, and that everything just gradually subsides over a period of weeks. The other thing we would like, though, in a formula besides the leaky gut healing effect is we want to have our dog calm. I mentioned that a lot of these dogs have behavioral issues. They're highly reactive, or they're very anxious, or they have extreme separation anxiety, or they could even have fear aggression. And much of that is, well, at the very least, the way you can look at it is it's aggravating the leaky gut. Why? Because all that stress releases a bunch of cortisol. And cortisol has an immune suppressive effect. When it's too much of it, has an immune suppressive effect that causes the gut to leak. Okay, so the stress aggravates the leaky gut. So given how commonly these animals are stressed, we want to help them out. But besides having a calming sort of influence, well, let's just leave it at that. We want these dogs to be calmed as well as to target their immune system. So when we look at a formula that tackles those big ticket items, you've heard this formula before if you're an Ask Dr. Steve active member. It's called minor Bupleurum. It's a 2,000-year-old formula, and it's got some heavy hitters in there. If you're using a good version, don't use a version of minor Bupleurum that doesn't have ginseng because you lose so much impact. Ginseng has a big impact on correcting dysbiosis and normalizing the immune response and calming animals down. If you use one that has codonopsis in it, you won't have any calming effect whatsoever. Don't use minor Bupleurum if it doesn't have ginseng in it. Another calming herb is Scutellaria. It's also anxiolytic, but it's also anti-inflammatory. Yet, you have your cake and eat it too here, because at the same time it's anti-inflammatory, it still supports local immunity, unlike Apoquel or Atopica or prednisone, which are just anti-inflammatory. They're just suppressing the immune system. Scutellaria will calm that whole situation down, but support normal immune system function, and therefore promote the growth of normal gut flora that the immune system likes by making a space, by killing off the bad guys. And then we have Bupleurum, also a have your cake and eat it kind of formula. It will control pathogen overgrowth on the gut wall that could make the gut leaky and damaged. It's also calming. It calms this excess Paul Revere type action, the shouting of the messages through the system, get ready, the microbes are coming, calms all of that down. And it also promotes antigen clearance. It helps to get rid of the things that are activating the immune system. So those three plants alone, a very powerful effect, a very comprehensive effect. As I said, 2,000-year-old formula, extremely well chosen, extremely well designed formula, extremely effective for immune-mediated disease. Now, last time you guys said, hey, we're going to talk about cats. And we talked about how cats most of the time benefit from a switch to a real food diet. However, there are some that have the true adaptive immune system issues. Here's one. This is Caper, a 8-year-old male neutered Siberian, and his chief complaint is chronic scabs that are refractory to antibiotics and to prednisone, and he's got idiopathic hypercalcemia. His blood calcium levels are just a little too high. This is an interesting, if that happens, if that shows up in your animal's blood work, I'm telling you, you know that you need to use minor Bupleurum formula. In Caper's case, things started happening 2 years ago in spring. So we commonly see these issues in spring and fall. Showing up with scabs on the neck, the head, the sides, the back. It was kind of cyclical, kind of comes and goes. The eyes are chronically weepy, weak appetite. So cats are always kind of muted in their presentation. So ideally, you want to change the diet first. And they did. And Keeper had a raw diet, and that didn't work. And then they said, okay, well, let's try some, not that I personally use these, but some hypoallergenic kibbles or canned foods, like Rain Kangaroo diet and Purina hypoallergenic diet. They did at least what? Atopica did aid at one point, and bathing does aid. So bathing is kind of helping to remove some bacteria that the system is responding to. But Atopica is essentially saying, okay, so this is an immune-mediated problem. From a laboratory or physical exam perspective, his tongue was red, his pulse was kind of weak. This is kind of, you don't really need to know this if you're just a pet owner. His ears were slightly red. He just had kind of a reddening of his skin. That was responsive to gallbladder points. And gallbladder points are oftentimes right in the zones where this inflammation is occurring. He had very high eosinophils. That is oftentimes a hallmark of a case that responds to minor Bupleurum. Eosinophils are a type of cell that are associated with either allergies or parasites. So if there's no parasites, you're thinking, okay, it's an allergy. And if it's an allergy, I want you to start to train your mind to think of minor Bupleurum. And he had that hypercalcemia that I mentioned. So he was put on a version of minor Bupleurum called Harmonize the Chi. And he was given a liquid version. They were using pred, so they slowly weaned the pred as he improved, eventually getting him all the way off the pred, kind of stair-stepping your way down. The way you do it, because a lot of you I know are in a situation where you have your dog's already on an immune suppressant, you're thinking, do I need to stop those drugs just instantaneously? I don't, because, especially if your dog's benefiting, they're less symptomatic. I don't like to rip the rug out from underneath an animal if there's been some benefits. So what I would suggest is you lower the dose until you start to see some itching. You find a level at which, okay, now they're itchy and uncomfortable, but not terrible. And then you wait and you give the herbs and you make sure the good diet's in place and you wait. And after a week or two, you'll notice that itch subsides and you're ready to drop down again on the drug dose. And once again, itch will show up. And once again, you just keep the herbs and keep going with the diet and you wait. And eventually those symptoms will go away and you just sort of stair-step your way down until eventually you're giving no drug and your animal is maintained by diet and herbs. And then if you're lucky, you can start to find the lowest required dose of the herbs. Now, we know that some of these dogs and cats, have issues maybe every 6 months. So you can be proactive. If you know it's kind of like a month before allergy is going to kick in, go ahead and restart them and just see them through the allergy season, and then you can stop it again. In Keeper's case, he responded quickly. So at day 14, the scabs, when he has recheck, the scabs were already gone. They were disappeared in 3 days. His scratching is way down, still grimps a little bit. By 90 days, they found they needed to keep going with the herbs in order to keep Caper symptom free. Okay, some of you asked, well, can I use the gold standard products, which contain minor Bupleurum? Can I use them in cats? Many people have used them in cats and they've been effective, but a lot of cats are not blood deficient. Now, if a cat did not respond to a real food diet, then they will probably tolerate the blood tonics. If you have not yet changed your cat to a real food diet, you really should try that first, because most cats are damp, and damp animals don't improve on Cessorex. Sometimes they can get a little bit aggravated. So some of you write into Gold Standard and you say, I used it and it's itchier than ever, but they haven't been feeding a proper diet. They've just been feeding a regular kibble. Those animals really should, those owners should go back to the first webinar and watch that one and do what they say in there first before, and then come to this one if they don't get anywhere. Okay, so for dogs, if we just use minor Bupleurum like we did in Caper, I don't find it works. We've got to use the blood formula, the one that treats endothelial dysfunction at the same time. It seems like those dogs have endothelial dysfunction as well as the leaky gut / cell-mediated immune reaction. Okay, so when would we use this Cessorex then? Exactly. Again, just you've heard it, but just to kind of reemphasize it again, a late summer flare-up. Beginning July, August, September, if that's when the skin starts to get bad, that's when you're looking at giving Cessorex. Or problems that just seem to be every 6 months. And it's almost miraculous how there's almost like a 6-month gap between the flare-ups. Dogs, like I said, are going to benefit more than cats unless the cats are already on a real food diet. You can consider this for any immune-mediated disease involving the skin, especially allergies, but also things like KCS. KCS is an immune-mediated disease. That's why we use cyclosporin eye ointment, which is an immune suppressant, to get rid of it. Skin problems that you definitely saw an improvement on the immune suppressants. It's just that you object to immune suppressants as a long-term treatment, which I certainly do. Okay. So fair enough. Sounds like it's all just lovely and magical. You lay your dietary foundation, which now you realize if you've got a raw-fed dog, you should put some plant material in there, put some probiotics in there, throw them on the Cessorex, and Bob's your uncle, right? Well, yes, actually, a lot of dogs do improve with that. Some dogs get itchier. Oh, no. What is the problem there? Before you throw out the baby with the bathwater, here's the situation. We mentioned how you have acute inflammation where everything's all red and swollen and inflamed, and you want to put an ice pack on there just to calm everything down. And then there's the opposite situation where it needs more blood, right? There's acute inflammation and there's chronic inflammation. This is chronic inflammation, endothelial dysfunction. This is just severe acute inflammation. The phase in between is called subacute inflammation. Some of the dogs are in the subacute inflammation phase. They're still kind of on the border of the ice pack phase of things. They still need a bit of an ice pack action. So for those animals, if they are not yet, if you gave Cessorex and they got itchier, this is what's happening. They're still subacutely inflamed. They need more ice pack. So how do you deliver that? Well, one way, and we mentioned this at the end of the first webinar, use 4 Marvels from Con Essentials and Cessorex together. And, maybe cut back on the Cessorex dose a little bit, emphasize the 4 Marvels. Do that, especially if you have not yet changed the diet to a real food diet. You're still on a kibble or a canned diet of some type. That's what you should do. For dogs that are already on a fresh food diet, I don't recommend that you necessarily jump in there with 4 Marvels. Now we have something better, or rather Gold Standard has something better, and that's called Immunobomb. Now, if you're an Ask Dr. Steve aficionado, you have heard me recommend Cool the Blood from Con Essentials. Immunobomb is Gold Standard's new answer to Cool the Blood. Basically does the same thing, except that as a granular extract, it's going to be more potent and less expensive. It's a herbal helper because it helps out our Cessorex cases, the ones that kind of are just really, really red and raw and inflamed and nasty and need some extra assistance. And in fact, if it's not just kind of like an immune-mediated allergic kind of dog, but they have an autoimmune disease, you probably need to be opening with Immunobomb. You can use Cessorex as well, but you should be also using the Immunobomb or the cool the blood approach. Another example of when I use this is in calcinosis cutis. That comes up a lot. And ask Dr. Steve, what do you got for calcinosis cutis? First, treat the Cushing's by feeding a real food diet. Lena has a great video that she's put up on treating Cushing's without drugs. I encourage those of you with Cushing's dogs to read that or to watch those videos in the Ask Dr. Steve YouTube channel and see if the calcinosis cutis goes away with that. If it does not, then Immunobomb oftentimes gets rid of it. What's in Immunobomb? Why does it work? There's the ingredients, long list of ingredients. Why does it work? Because it's got that anti-inflammatory effect on the surface of your body. And it's anti-infective. It helps kill off bacteria, helps to kill off yeast. It does counter endothelial dysfunction. It does improve the blood supply of the skin, but in a controlled anti-inflammatory sort of way that it makes it a bit better a fit for a severely inflamed dog than a full-on dose of Cessorex. Here's a tip. If you got your dog and you just have them against your body, and if you're sweating where the dog contacts you, that you need this Immunobomb stuff because they oftentimes have an extremely hot torso and cold extremities and cold ears as a hallmark trait for a dog that is going to benefit from Immunobomb. Using that first. I'm going to show you a case of Dr. Carnes shortly, where she used this as her opening shot across the bows before she finally fixed the case up with Cessorex. Oftentimes the lesions are very nasty, they're very red, they're very itchy, it's a really unhappy, miserable animal. So if in doubt, go ahead and use the Immunobomb along with the Cessorex. One more herbal helper that is being introduced. I'll just tell you about this real quick, and then we'll close with a case or two. This is Galvanex. So Galvanex is essentially lift the qi. Lift the qi is a formula called ginseng and astragalus or bu zhong yi qi tong. So again, because it's a granular extract, it's more potent than lift the qi, and it's going to mean it's going to be more cost effective. So these things are not pills. So if you like pills, you'll want to continue using the Con products when they're available. But if you're not attached to pills or you're okay with making your own capsules, then you can go ahead and use the Immunobomb or the Galvanex. They're going to be flavored and unflavored and large-sized versions available for each as well. So what does Lift the Qi do? How does it help out with skin stuff? Some animals are not really badly inflamed. They're actually kind of just gently itchy. Or they may have very low-grade inflammation on the periphery of their body, such as leukoid onychodystrophy or pododermatitis, where the lesions are not that red and nasty, but they're just always there. These peripheral infections that just never go away in poorly perfused areas, that's the hallmark of a dog that will improve from Galvanex. As well, though, because Galvanex bolsters the immune response in the skin, it also does it in the gut. So why is that useful? Because if you just throw a probiotic in there, remember we said, how do you lay the foundation? It's like a fresh food diet, meat-based, 1/6 to 1/3 plant material, throw your probiotics in there. Okay, fair enough, should work, right? What if it's like a parking lot at Christmas and your probiotics, they're sailing through, they have to adhere to the gut wall. That's why we like lactobacillus and bifidobacterium, because they sticky things that allow them to grab onto the gut wall. If there's no space, they just keep driving and they leave the parking lot and they say, I guess Jimmy is not getting their Christmas present this year. So we use things like Galvanex to create a parking space. If we use wholesale immune suppressants, then we really end up screwing up the gut. And Galvanex also will improve dogs that have been on Apoquel or Atopica for a long period of time, and where it has damaged their immune system and their gut. So by bolstering the immune system of the gut wall, it will then attack bad guys that are attached to the wall, clear a space, and then bifidobacterium and lactobacillus that are floating along, they'll that come and sit on the gut wall, and they'll start to repair the leaky gut. So that's how Galvanax works in the intestinal tract. It's not the only thing. Karin's a big fan of colostrum, so am I. Mushroom extracts, many of you are using mushroom extracts. They're a nice, gentle, benign way of stimulating the immune system through the content of their immune polysaccharides. Other astragalus containing formulas, or else there's Galvanax or Lift the Cheap. Who's the immune stimulants in there? Particularly ginseng that we talked about before, and also astragalus. Very powerful immune system stimulants to kind of help get on top of infections, not only in the gut, but also in the skin, again, in these poorly perfused distal areas. And it will even deal with things that are not necessarily infections, but chronic low-grade inflammatory problems that just need to be actively resolved by bringing the blood supply to them. Galvanax does that quite well. It can be used with these other formulas to kind of help boost their peripheral circulation enhancing effects. So the picture there is leukoid onychodystrophy. Galvanax by far my favorite treatment for that kind of problem where the nails just fall off, regrow, fall off, regrow, fall off, regrow. Okay. There are other kind of classical symptoms that are related to the digestive tract of these animals. But rather than confuse the issue, I'm just going to leave that. You guys can review the video and study those at your leisure. I will say that a lot of these animals are anxious. So not in an extremely reactive sort of way, which is very typical of a Cessorex dog, but kind of in a fearful, kind of feeling small and put upon kind of way. So anxiety would be another major indicator for the use of Galvanax. Finn is a approximately 4-year-old female spayed mixed breed. Finn had immune-mediated vasculitis, okay, so an autoimmune condition. Now, can you remember which formula do we resort to when we have autoimmune problems, not just allergies, but something worse? If you were saying the immunobomb, then that is correct. In Finn's case, its problems began, her problems began fall 2016. So there we have our fall onset with hair loss. 50% of the hair on the head, the legs disappeared, patchy alopecia over the bones of the bum, and a thinning coat over the spine. And then again, half the hair disappearing from the head and from the legs. They did an ELISA test. They found that the dog was positive for scabies. So they went ahead and treated for scabies and using NexGard and antibiotics, and it had no benefit. So spring, still positive for scabies and getting worse again. Notice spring, fall, spring, fall. The flare-ups occurring that drive this dog to be, drive the owner to take this dog to the vet. This time they used a variation on the theme, Brevecto, and that converted Finn to scabies negative over 3 months of treatment. I know you're not necessarily fans, but this is the medical history, so don't kill the messenger. Finn was then abandoned to the beach in Morocco by this previous owner. I guess they felt they'd done their duty, and eventually was taken in by a foster in October 2018. So there we are 6 months later. Finn has a lot of reactivity, a lot of aggression to other dogs. Remember, I said that this is commonly a feature of dogs with this adaptive immune system issue that involves leaky gut because of this brain, gut, skin axis. Okay, so adopted in the fall, the following late summer, began to get cutaneous ulcers in its pads of its feet, the elbows, and the ears, and the lesions were nasty. You saw that photo here. I'll just go back to it. That is a nasty looking ear. So that's what they were contending with. The ear canal also chronically infected and inflamed to the point of being completely obstructed. You've heard us talk about dogs with candidates for TICA surgeries, the total ear canal ablation surgeries, and how we use herbs instead of surgeries in order to rescue those ears. So this was a dog that had that same issue. Eventually, the dog was worked up enough that they diagnosed immune-mediated vasculitis. If the dog had been in Karin's hands, they probably wouldn't have needed this full-on workup. She probably wouldn't have been able to fix it much more quickly. But they didn't know what was causing such incredibly severe lesions, and eventually they diagnosed it with essentially an autoimmune disorder. So, of course, they gave corticosteroid therapy. And oh my goodness, what a fantastic response in just a month. Everyone partied and celebrated, except for the fact that the dog stopped responding to immune suppressive therapy. Remember, we said this is a hallmark trait of dogs with this whole adaptive immune system, cell-mediated reaction, leaky gut business going on. She also had associated hind end weakness and was trembling after her walks. The owner moved from Morocco, where she had rescued this dog, to Alberta in late 2019, and that's when she stumbled upon a fabulous Dr. Karen Marsden, and Karen got to work. So here's kind of how things looked to kind of start off with. When Karen first saw Finn, you can see the ear canal is totally closed there in the top left. You can see the pads sloughing in the top right, and you can see the nasty ear that we saw before. And just, the head not looking too healthy, its skin not looking too healthy, and the dog just generally looking unhappy. So here's Karen starting to go ahead and, treat Finn. You can see there's no hair in the head left anymore. There's Karen's hands and acupuncture needles going in. You can see these, the ear has so badly damaged that chunks of it are missing. Nevertheless, she looks like she understands that this might finally be some help, right? And I just see that in her eyes. Anyway, she went on the equivalent of Immunobomb, 1 teaspoon twice a day for a dog that size, for that refractory skin inflammation, ulceration, just the nastiness of it, and also the fact that it was basically an autoimmune skin condition. And just 2 weeks, and she's starting to see some hair growth, and the ear already is looking just a lot less ugly. So that was very encouraging, and her muscular strength is improving. The pain is subsiding. There is some benefit of Immunobomb on immune polyarthritis as well. Still, the limbs were cold and the ears and the head were hot. In this case, we interpreted that as this kind of problem with yang energy being stuck in the exterior of the body. And that's what Immunobomb is famous for treating, for basically helping to insert the yang energy into the body core, where it can then normalize circulation and taking it away from the severely inflamed periphery. So all well and good. We figured we are now ready to kind of use the Cessorex as the runner-up. This is the formula that most dogs that initially respond to Immunobomb eventually need to kind of become fully cured. And so Finn started on that Cessorex. It was a dose-related response, meaning that when she slacked off on a dose, the dog got worse. When she increased the dose, the dog got better. Some of you ask, my dog is just not quite responding a little bit. What should I do? You should bump up the dose, because if they're handling it, then they're going to be much more responsive to a larger dose. You can see the paws healing there. You can see the hair coming back in the head. You can see the ear looking much more healthy there. And the ear canal obstruction just went away. So, because it's just chronic inflammation. And if you resolve the chronic inflammation, then the ear canal just opens up again. Allergies can be cured. The first webinar, we said you can cure them by basically just lowering the overall inflammation of the body below the allergic threshold, at which point, even if they're exposed to something they're theoretically allergic to, it doesn't matter, because you can't see the inflammatory response, because the system is overall so quiet that it's some little skirmish that remains below what is visible to the naked eye. In tonight's webinar, we're talking about how allergies can be cured just by sealing up the gut wall, by helping the microbiome do a much better job. The diet you should be using, a reality for healing and curing allergies, is feeding a real food diet. It probably should not be devoid of plant material. It probably should have up to 1/3 plant material. And you should probably be supplying some probiotics like lactobacillus and bifidobacterium as a minimum. And then you can layer in your herbs just to kind of expedite the improvements. So if a dog is radically better on a real food diet, maybe just use 4 Marvels. That's all you need. That was from the first webinar. If the dog doesn't resolve, you should be looking at Cessorex. But if the inflammation is extremely severe, like in the last case, then you would start with Immunobomb and then add Cessorex in later. For mild skin lesions or mild lesions of the digits or mild pododermatitis or a mild itch, then you can use Galvanex with Cessorex. That will help the dog have a normal immune response in its skin and also its GI, and it will help the probiotics take. I wouldn't recommend Galvanex for the severely inflamed animal, but once the animals are not very severely inflamed, you can use Galvanex in all of them in order to help your probiotics work better.